Good afternoon, everyone. Before we begin, I'd like to acknowledge the traditional custodians of the land we gather on today. We honor the elders, both the past and the present, and extend our respect for any Aboriginal and Torres Strait Islanders individuals here with us today. Their culture, tradition, and knowledge are essential to our community. Thank you for joining us to discuss providing hygiene education for Aboriginals and Torres Strait Islanders communities. I'm Molly, and with me are Abdallah, our interpreter, Subeksha, a colleague focused on community health, and Prashant, our health educator. Our focus today is on the importance of hygiene education, the challenges we face, and how we can adapt our approach to meet the unique needs of this community.
Hygiene education is key to promoting healthy living, preventing disease, and improving overall well-being. In this context, it covers personal hygiene practice like hand washing, dental care, and sanitation. These practices are especially important in the communities that may lack access to adequate water and sanitation facilities. However, many indigenous communities face barriers such as limited access to clean water and culturally tailored hygiene resources. These barriers make it difficult to adopt consistent hygiene practice.
That's right. Additionally, cultural sensitivities around hygiene topics such as menstrual health
Natural.
can make open discussions challenging. In some remote areas, there may also be a distrust of mainstream healthcare, further complicating the delivery of hygiene education. It's crucial to address these cultural and logistical challenges by working closely with communities we aim to support.
To effectively address these challenges, we need to implement strategies that are culturally relevant. One approach is to involve community elders and leaders in program development. Their guidance helps ensure the education is meaningful and builds trust among community members. Prashant, can you share an example of how working with elders has been successful in past initiative?
Certainly, in one program, we collaborated with community elders to integrate traditional knowledge with modern hygiene practices. The elders shared their teaching on cleanliness and respect for the body, while we provide information on hand washing, dental care, and sanitation. This partnership made the workshop more effective and widely accepted. We also included anonymous question boxes, which allowed people to ask sensitive questions without feeling embarrassed.
Involving local leaders is important, and another key strategy is providing cultural competency training for educators. Educators need to understand indigenous perspective on hygiene and health to communicate more effectively. We should also focus on peer education, where young community members act as role models for their peers. This approach makes hygiene education more relative.
That's a great point, Suveksha. Peer education can be powerful in schools of communities. We could also prioritize creating hygiene materials in the indigenous language and using various media formats, like videos, to make the information more accessible. Adela, how can we ensure our materials are culturally and linguistically appropriate?
By working with local translators and cultural consultants, we can ensure that the materials are accurate and resonate with the community. Involving the community in the process also fosters a sense of ownership, making the materials are more effective.
That's excellent insight. Another idea is mobile health service that brings hygiene education directly to remote areas. This will allow us to meet people where they are, providing essential services like hygiene kits and education in one place.
Exactly, and let's not forget the importance of involving families. We can organize workshops for parents and children to learn about hygiene together, which will reinforce these habits at home.
In summary, providing effective hygiene education for Aboriginals and Torres Strait Islanders communities requires a comprehensive community drive approach. We need to engage local leaders, develop culturally relevant materials, and offer flexible delivery methods to ensure we are meeting the needs of the community. Thank you.
Thank you. रोक दो ना तो वीडियो. Start sir. Okay. Start. Yeah.
Okay, evaluation meeting script. Assessing the hygiene education program for Aboriginals and Torres Strait Islanders communities. Evaluation of hygiene education program for Aboriginals and Torres Strait Islanders communities. Good afternoon, everyone. I'd like to begin by acknowledging the traditional custodians of the land on which we meet today. We honor their elders past and present and extend our respect to any Aboriginal and Torres Strait Islanders individuals joining us. Their deep-rooted culture, tradition, and knowledge are valuable to our community. Thank you all for being there here to help us evaluate our hygiene education program designed for Aboriginal and Torres Strait Islanders community. I'm Molly, and with me Abdallah, our interpreter, Subeksha, my colleague focusing on community health, and Prashant, our health educator. Today our goal is to assess the program's effectiveness, gather your feedbacks, and identify areas where we can improve.
Let's start by reviewing the program's objectives: improving knowledge around personal hygiene, promoting good hygiene practices, and reducing health risks. How do you think we have made these goals? What feedback have you received?
I have noticed a growing awareness among participants about the importance of proper hand washing, dental care, and overall hygiene. Many report that they have incorporated this practice into their daily lives. However, some participants have expressed a need for more resources, especially around access to clean water and sanitation facilities.
That's positive feedback. Suvesha, Prashant, what do you think we can do to address the need for better access to resources?
We could collaborate with local organizations to provide hygiene kits and work with our government agencies to improve water and sanitation infrastructure. Additionally, we can create digital materials that offer guidance on hygiene practices when access to resources is limited.
Creating these resources in indigenous languages and ensuring they are culturally sensitive would help increase engagement and make the information more accessible.
Engaging local community health workers is also important. They are trusted figures and can provide ongoing support and reminder about the importance of hygiene, particularly during key health events.
Okay, now let's consider the challenges we encounter during the implementation of the program. What barriers affect participation?
Cultural sensitivities around discussing personal hygiene, especially in public forums, were a challenge in some areas. Working more closely with community leaders before launching the program might help ease these concerns and build trust.
Additionally, logistical barriers like transportation and the availability of clean water made it difficult for some participants to fully engage with the program. We should consider ways to bring our sessions closer to participants and address infrastructural gaps.
These are important observations. What strategies can we adopt to ensure our program is both accessible and culturally appropriate moving forward?
We should involve vendors and community leaders in the planning and delivery of hygiene education. This way we can ensure that the program respects cultural values while promoting good health practices.
It's crucial to keep the community at the center of decision making. Collecting ongoing feedback and making adjustments based on their input will ensure the program remains relevant and effective.
Regular evaluation tools like surveys and informal discussion can help us monitor progress and identify areas for improvement in real time.
Thank you. Thank you all for your valuable contribution. It's clear that an ongoing community drive approach is key to the success of our hygiene education program. I'd now like to open the floor for any final comments or suggestions.
Thank you. Finished. Go home.
Patao